What is post-void residual volume, PVR? Post-void residual volume, often referred to as PVR, is a crucial measure in understanding bladder health. It represents the amount of urine left in the bladder after a person has urinated. This measurement helps determine how effectively the bladder empties during voiding. A healthy bladder should empty completely, leaving only a small amount of urine behind. To measure PVR, healthcare providers typically use two methods: bladder ultrasound and catheterization. Bladder ultrasound is a non-invasive technique. A device is placed on the lower abdomen to estimate the volume of urine remaining in the bladder. On the other hand, catheterization involves inserting a thin tube into the bladder through the urethra. This method allows for direct measurement of the residual urine. In general, a small amount of residual urine is normal, usually less than 50 milliliters. A PVR of under 100 to 150 milliliters is often considered acceptable, but these numbers can vary. When the PVR exceeds 200 to 300 milliliters, it may indicate incomplete bladder emptying, a condition known as urinary retention. This can signal potential issues with bladder function or obstruction. Measuring PVR is particularly important in diagnosing and managing various bladder conditions. These include benign prostatic hyperplasia, neurogenic bladder, urinary tract infections, and bladder outlet obstruction. It can also help evaluate symptoms like frequent urination, urgency, weak urine stream, or difficulty starting urination. In the context of bladder cancer, monitoring PVR can be vital. Incomplete bladder emptying may raise the risk of urinary tract infections and bladder irritation, complicating existing bladder issues. Additionally, certain treatments for bladder cancer or surgeries can impact bladder emptying, making PVR monitoring essential for follow-up care. In summary, post-void residual volume is a key diagnostic tool that quantifies the urine left in the bladder after urination. It provides insight into how well the bladder empties and helps identify any dysfunction or obstruction that may require medical attention. If you have concerns about your bladder health, it is always best to consult a healthcare professional for personalized advice and evaluation.